Egalitarianism guarantees medical mediocrity. Entrepreneurship, innovation, competition save lives. U.S. presidential elections elevate Canadian medical care, colloquially known as Medicare, as a role model of universal coverage. However, the COVID-19 spread has exposed its many shortfalls and triggered a public debate over allowing private alternatives. A chief concern, though not the only one, among reform advocates is waiting times for medical attention and surgery. Integrating private and public medical services could offer swifter, patient-oriented care. Medicare's proof is in the pudding. With 1,062,286 people on waiting lists in 2019 and 217,500 people heading abroad in 2017 to pay out of pocket rather than face rationed care. In September 2020, British Columbia's Supreme Court ruled against broader private medical care. Plaintiffs had argued that excessive delays were a violation of Canada's constitutional rights to life, liberty, and security. However, the ruling did not deter supporters of expanded options, and liberalization efforts will prevail eventually. In October 2021, Alberta's United Conservative Party, UCP, officially endorsed a policy to create privately funded and managed medical care. Awareness of the need to reform Medicare is here to stay. Public is not universal. The primary concern regarding the presence of private medical care is the emergence of two tiers of quality. Rather than prioritizing patient urgency and need, the argument goes, access to medical attention would stem from someone's capacity to pay. This objection ignores reality. Affordability already rules the game, as Medicare severely fails to satisfy demand. In 2019, 12,336 patients on Medicare waiting lists ended up in private care thanks to contracts between public authorities and medical providers. Further, we all know that wealthy Canadians can and frequently do access better, swifter treatment abroad. Pretending there is only one tier of medical treatment to defend the dysfunctional status quo is childish, dishonest, and harmful. The lack of timely care also leads to the overuse of the emergency room, where patients usually wait more than 2 hours for aid. Waiting increases the likelihood of pain, mental anguish, and even death. According to a Fraser Institute study, delays caused the deaths of 44,273 Canadian women between 1993 and 2009. More recently, in Quebec, 12 patients died from January to April 2019 while waiting for surgeries. During the COVID-19 virus spread, the backlog in surgeries snowballed. The system's limitations forced people with severe conditions to postpone scheduled medical interventions, such as hip replacements and heart surgeries. For Christine Van Gyn, litigation director at the Canadian Constitution Foundation, Canada must allow room for entrepreneurship and medical care to tackle current constraints, lest the problems compound in the long run. An active role for the private sector would address bottlenecks, improve overall quality, and save taxpayer dollars. The solution is out of the box. In early October 2020, the Alberta government announced it would cut 11,000 medical jobs in an attempt to save $600 million per year. Given legal prohibitions, unfortunately, plenty of these physicians and medical staff could not find employment in the private sector. The Canada Health Act forbids dual private-public practice for doctors and the private provision of treatment covered by Medicare. This blocks the very supply that would lower costs and increase availability. Medical care is Alberta's largest budgetary expense, but recent events have shown the system is vulnerable to demand fluctuations. Rather than replicating the usual by piling on more public spending, the UCP wishes to create hybrid medical care. Patients would be able to choose between medical providers, and private actors could contribute to the sector's investment and innovation. According to the UCP, the modicum of competition would also encourage medical tourism, so the scope of the industry could grow beyond ensuring swift care for Albertans. Public provision's true cost. In Calgary, doctors have started a campaign against possible medical care privatization in Alberta. They argue allowing private medical care could increase costs, although their likely motive is continuity for their professional monopoly. Laurie Williams, a political science professor at Mount Royal University, countered with Global News that, quote, healthcare workers can make more money in the private system, unquote. Therefore, they would go to the private sector, impoverishing the quality of public medical services. This commentary, however, merely affirms the lack of resilience and self-sufficiency of Medicare. In a 2020 report, the Fraser Institute revealed Canadians have no clear picture of the actual cost of Medicare. The main reason is that they do not pay directly for their use of medical care at the point of contact. Rather, the cost consumes an opaque portion of Canada's tax revenues. The classical liberal think tank estimates the average payment for public medical insurance in 2020 ranged from $4,190 to $14,474 for 6 Canadian family types. The 10% of families with the lowest incomes paid an average of $471 in public insurance in 2020, and the top 10% of income earners paid $39,731. Considering the money going in and existent shortfalls, there is plenty of untapped room for improvement. Lawmakers, however, will have to leave their comfort zones. Germany, for instance, allows private medical insurance to operate alongside the statutory one, and together they cover 100% of the population. Most of the German health indicators, such as waiting times and infant mortality, outperform Canada's. Similarly, New Zealand's public medical care is widely available, at least for emergencies. However, citizens are able to acquire private health insurance too, which gives them more flexibility and timely attention. Rather than undermining public medical care, the private sector has been able to provide a broader range of treatment options and help alleviate capacity challenges in the public system. Centralized surveillance and issuance of mandatory best practices will not provide long-term solutions to Medicare's shortfalls. The pandemic has uncovered the need to take further action to garner better outcomes. By allowing room for competition and entrepreneurship, Medicare can use its budget more wisely and patients can get the attention they need.